Hello, and welcome to UT Medical Center Orthopedic Institute. My name is Kiki McKissick, and I'm the orthopedic coordinator here with UT Medical Center. And today, I will be talking to you about recovering from your orthopedic fracture. So what is a fracture? A fracture is a broken bone, the same as a crack or a break. A bone may be completely fractured or partially fractured in any number of ways. Some fractures may require surgery. Your doctor will tell you what to expect during your recovery period. Your doctor may also recommend physical therapy to help strengthen the muscles around your broken bone. Pain after surgery. Pain is typical and expected after surgery. Pain medications will not eliminate all of your pain, but it should make it tolerable. Pain medication may cause nausea, vomiting, headache, or skin rash. If any of these symptoms do not improve, please contact your orthopedic surgeon. Medications that are commonly used after orthopedic surgery includes opioids for pain control, blood thinners to help prevent blood clots, and also stool softeners and laxatives. Your surgeon will prescribe the appropriate medications for you. Your nurse will review your medications with you before you leave the hospital. Please let your nurse know if you have any questions or concerns on how to take your medications. Managing pain after surgery. Take your medication as prescribed, but only as needed. For example, take every 6 hours as needed for pain. This means to take pain medicine when you start to hurt, but no sooner than the time on your prescription. Slowly decrease the amount of pain medicine you are taking as your pain decreases. Do not take anti-inflammatory medications such as ibuprofen, Motrin, Advil, naproxen, or Aleve for at least 6 weeks after your surgery, unless your surgeon instructed you otherwise. These medications have been shown to delay bone healing. Do not take any additional Tylenol or acetaminophen. If the pain medication you have been prescribed contains Tylenol, the dosage of Tylenol should not exceed 4,000 milligrams in a 24-hour period. Now let's talk about common post-operative complications and preventative measures. Constipation management. After surgery, constipation is a common problem. Pain medication can slow down the digestive system and can lead to constipation. Purchase stool softeners and laxatives to have during your recovery. Stool softeners such as Colace or Miralax, laxatives such as Senna or magnesium citrate. Blood thinning medications. You may be prescribed a blood thinner medication for a short time after your surgery. Not all surgeries will require a blood thinner medication. Blood thinners are given to prevent or treat blood clots. Examples of blood thinner medication: aspirin, Eliquis, or Levinox injections. Common side effects of blood thinning medication could be bruising, bleeding gums, blood in your urine or your stool. Your surgeon will decide which medication is right for you. Blood clot prevention. Move your legs. If you have had surgery or have been on bed rest, try to move as soon as possible. Drink plenty of fluids. Take blood thinner medications as ordered by your surgeon. Try not to cross your legs while sitting. Doing so can block blood flow. Do not smoke. Smoking increases the risk of a DVT. Manage weight. Obesity is a risk factor for DVT. Regular exercise can lower the risk of forming a blood clot. Symptoms of a blood clot. Deep vein thrombosis occurs when a blood clot forms in one or more of the deep veins in the body, usually in the legs. Symptoms of a blood clot: leg swelling, leg pain cramping, or soreness that often start in the calf. Changing skin color on the leg, such as a red or purple, depending on the color of your skin. A feeling of warmth on the affected leg. But keep in mind, a blood clot can occur without noticeable symptoms. Weight-bearing status. Non-weight bearing. It means the injury cannot withstand any weight whatsoever, and attempting to do so would cause further harm or prolong your recovery. Partial weight bearing. The injury can tolerate a small amount of weight. Partial weight bearing means that you can only apply a certain percentage of your weight to the injury, but not all of your weight. Touchdown or toe touch weight bearing. You can touch your foot or toes to the floor to maintain your balance, but your leg, ankle, or foot cannot withstand any actual weight. Weight bearing is tolerated. Is recommended for mild injuries that can tolerate anywhere between 50 to 100% of your weight, or at the end of your recovery period. Full weight bearing means you can withstand the normal weight that occurs from standing, walking, or using the affected injury. Your nurse will review your weight-bearing status with you. Infection prevention. Wash your hands before and after touching any area of your bandage. Do not let your pet sit on or near your surgical site. Clean your bed sheets often. No pets in your bed during recovery. I know we all like to think our little pets are clean, but their little paws and booties can carry germs that we don't want near your surgical incision. Use a clean towel and washcloth with each shower or sponge bath. Wear clean clothes and always keep your incision clean and dry. Ice therapy. To help control pain and swelling, you are encouraged to use ice therapy frequently after surgery to minimize pain and swelling. Use an ice pack for 20 minutes at a time. 20 minutes on, 20 minutes off. Arm elevation. Keeping your arm elevated. Keep your arm elevated as often as you can. This will help decrease swelling and pain. Prop your arm on pillows or blankets to keep it elevated comfortably. After surgery, your nurse will teach you to perform deep breathing and coughing exercises, which will help prevent pneumonia. In addition to deep breathing and coughing, your nurse will teach you to use a breathing device called an incentive spirometer. This is used to expand your lungs and help get oxygen to the tissues in your body. It helps to clear your lungs after receiving anesthesia, and it also helps to reduce fever. It will also help with nausea and tiredness. It is important to use the incentive spirometer 10 times per hour while you're awake. Continue to use the incentive spirometer until you follow up with your orthopedic surgeon. At the time of discharge, you will have discharge prescriptions. For your convenience, UT Medical Center has an outpatient pharmacy available. If you want to have your prescriptions filled at the medical center, just ask your nurse to fax it down to be processed. A family member can assist you with picking up your medications. The hospital pharmacy is located across from the hospital cafeteria. Eating healthy after surgery. Good nutrition helps wound healing. Your appetite may be poor for a short time after surgery. Drink plenty of fluids to keep from getting dehydrated. It's important that you get enough protein. In the first 2 weeks after surgery, your body needs more protein to help heal. Eat foods high in calcium and vitamin D. Eating a well-balanced meal will help you recover quickly. Here on the screen are several reasons why you should contact your orthopedic surgeon during your recovery. Please call if you develop a temperature of 102 or higher. If you have drainage from your incision, especially pus or drainage with an odor. If you have redness or warmth around your surgical site. If you have calf pain or pain increasing in your lower legs. If you have dizziness or new onset of confusion. If you notice blood in your stool or your urine, or if you fall and hurt your surgical site, please contact your orthopedic surgeon's office. University Orthopedic Surgeons has several locations for your convenience. Please call 865-546-2663 for an office near you. Thank you. And lastly, thank you. Thank you for allowing UT Medical Center Orthopedic Institute to care for you.